Of course, you can't cup down water. Nobody will tell you. When you put the water in your mouth and it's not going down, you know that you have to stop. Hi, lovely people. Welcome to the Black Bariatric Hero community. My name is Oluwa Felumi and I am your host on this channel. To all my returning subscribers, thank you so much for stopping by. I really appreciate you. Thank you for subscribing to my channel and being a part of the community. To everyone seeing my face for the first time, thank you for stopping by. You might consider subscribing to this channel and joining the community. So this is the Black Bariatric Hero community. On this channel we talk everything about weight loss, surgery, everything that has to do with weight loss, lifestyle, faith, life in general post surgery for me. So it's a channel to record my progress and support other people going through weight loss surgery. So I hope you find this interesting enough to join the community. So today's video we will be talking about everything that you need to know about weight loss surgery, from what weight loss surgery is, the different types of weight loss surgery, how to prepare for weight loss surgery, the cost, and everything in between that. Okay, talking about what weight loss surgery is, or what bariatric surgery is. So weight loss surgery are medical interventions or surgical interventions to manage obesity or obesity related conditions. Okay, so these are procedures that are carried out to help you, give you a boost on your weight loss journey. So this surgery does not automatically mean you're going to lose weight. It just helps to give you the boost that you need to kickstart your weight loss journey. Because even after your weight loss surgery, you definitely still need to eat healthy, you still need to exercise, you still need to be conscious of how you manage your health. Okay, so the surgery is just to manage obesity and other complications that are related to obesity. Okay, so generally the aim of weight loss surgery is to reduce the size of your stomach so that you have less capacity to take food in, and also to reduce nutrient absorption. So that's the major goal of weight loss surgery. So when you talk about weight loss surgery, everything that is done is aimed at achieving this, that is reducing your stomach size and reducing your nutrient absorption. So what are the different types that we have? So majorly there are three different types of weight loss surgery. The common ones are the gastric sleeves and the gastric bypass. However, there is also what we call the gastric band or the adjustable band or gastric balloons. So these are less invasive procedures. So I'm going to start with the gastric band or the gastric balloon or the adjustable balloons. So they are minimal invasion procedures. So for the gastric adjustable band, it's a band placed on the stomach to reduce the size of the stomach. So this one, they're not cutting off your stomach. You can later take off the band if you attain your goal weight and if you don't need it anymore. You can take off the band. Okay, so this is like an adjustable band that that reduces the size of your stomach. And the same thing with the gastric balloon. So for the gastric balloon, just like the name states, it's a balloon. You swallow it under medical condition, of course, under medical supervision rather, and then it's inflated in your stomach. So the size of the balloon will occupy space. Okay, so it's inflated in your stomach and then it occupies space in your stomach, so you have lesser space for food. So this is also to achieve the idea of having a smaller stomach. So that's for the less invasive one. So the second one is the gastric sleeve. So for the gastric sleeve, 70 to 80% of your stomach is cut off and you are left with a small portion of your stomach, which is about 20 to 30%. That is where you eat. So there's no alteration to the anatomy of your intestine, really. It's just a reduction in the stomach. That's for gastric sleeve. So your stomach is reduced by 70 to 80%, but then your intestine is still the same. Your esophagus, where your food come in from your mouth, is still the same. So your food literally still follow the same pattern of digestion. However, the size of your stomach has been reduced surgically. So this helps you to eat minimal food, but you still absorb most of your nutrients as normal. Okay, so that's for the gastric sleeve. And finally, the gastric bypass. So gastric bypass is a more complicated form of weight loss surgery. So a lot of time when people fail their gastric sleeve, we are still going to get to that. When people fail their gastric sleeve, they have a reversion to bypass. So the gastric bypass, you can do the gastric bypass on its own at the first time, but also when you fail the gastric sleeve, you could also do a gastric bypass afterwards. So for the gastric bypass, is a more complicated one. So for gastric bypass, the direction of your intestine, so your intestine, the part of the intestine that absorbs food, is relocated. So they cut the stomach into about half, and then a part of your intestine is attached to the upper half. The top part of your stomach is left to take in food and to pass food on to your intestine. However, there is a part of your stomach that is cut off, but it still remains. They don't take it out. It's really still inside the stomach. It does not float. Don't bother about that. It does not dangle around, or it does not cause any harm. But it's a really complicated form of the weight loss surgery, and it has higher risk of complication. It takes longer time in the theater, and it just has a lot going on with it. But it has been proven to have better results. It has been proven to have better results. What is the requirement? Is it everyone that can have weight loss surgery? How do you qualify to have a weight loss surgery? So the general standard for having weight loss surgery is your BMI. So for your BMI, if your BMI is greater than 35, qualify to have a weight loss surgery. And if you're within the age of 16 and 70 years, you can have the weight loss surgery. So for the BMI is your body mass index. So that is your weight divided by your height square. So your weight divided by your height square will give you your BMI. You can check this out. You can do your calculations and see what your BMI is. So you cannot just say, because I weighed so weight, I'm going to have a weight loss surgery. Your BMI needs to be above 35. And even if your BMI is above 35 as well, in most cases, hospitals will offer you other options rather than surgery, because surgery is regarded as an extreme measure for weight loss. So if you're required to lose maybe 5 to 10 kg, I personally won't advise to have a weight loss surgery, because it's not actually worth it if you need to lose that little. But if you're looking to lose, say, 30, 40, 50 kg, yeah, I would definitely suggest that you have a weight loss surgery, because that way you have a better chance. You have better chance of seeing good results, and you have better chance of success. Because one of the major problems we have with losing weight, that I had with losing weight, was doing so much and getting very little results. Doing exercises and diet and everything and getting very little results, it can really be frustrating, especially if you have a long way to go. But if you have a boost like a weight loss surgery that you've had, then you see good results for the little effort that you put in. So when you do exercises and you eat little food, which you will feel full with the little food because you've had surgery, then you see better results, and that encourages you. So yeah, so that's for the requirement. You need to be a BMI of above 35, and you also need to be 16 years, between 16 and 70 years of age. So how do you prepare for weight loss surgery? So for the preparation of weight loss surgery, first I would say inform your doctor. So that is very, very important. If you're in other parts of the world, in any part of the world, speak to your health practitioner or to your doctor first about your weight loss surgery. The reason being that, especially if you're not having the surgery in the country where you are based, you will need a follow-up care, a post-operative care. So you need someone that is aware of what the situation was and what the situation is to be able to manage you. So you need to speak to your doctor first. So you don't just fly yourself out to another country and have surgery done. You need to have somebody that will be responsible for you when you come back from that country or from wherever you've gone to have your surgery. So first, inform your GP, have your tests done. You need to have tests done to be sure that you are fit to have surgery. So you need to have your heart checked. You need to have endoscopy to see that you don't have hernias or you don't have any condition that will put you at greater risk of surgery. For most people that will be having weight loss surgery, they've not had surgery before. Someone like me, I've never had surgery before. This was my first surgery, and I needed to know that I will wake up from anesthesia and that I'm healthy enough to have surgery done. And I think it's a wise thing for you to do as well. If you're considering having weight loss surgery, please run your tests. Have your blood test done, see what your levels are with your hormones, do your sugar test so you know that your recovery period will be shorter, because if you have high blood sugar, your tendencies of wound healing will reduce greatly. So you need to do all these tests, so your doctor needs to be aware. So you need to inform your doctor about your plans to have weight loss surgery and follow the procedure for your hospital or your country regarding that. And also you need to find out your options. What are the options you have? What is going to work best for you as relating to how much weight you want to lose, how soon you want to lose the weight, and what are the likely side effects or risks that you are going to be exposed to. So you need to assess your option, like examine your options and see what are the things that are likely to work for you as a person. So for me, when I had my surgery, I had to look at one, what are the risks involved in each of these different types of the surgery, and how soon am I going to recover from each of the surgery, how sustainable, what is the long-term results of them. So if I do this and I lose weight in 1 year, how will I look in the next 10 years? Okay, and is this sustainable? So I had to look into all of this, and I think that's the wise thing to do, really. So you need to look into all that you're likely going to experience with the procedure you're going to go for. Examine your options well, and also consider the cost as well, the recovery period, the likely complications. All these you need to consider before choosing which one you're going for. And if you are an immigrant in another country like I am, you need to also prepare for what your options are in terms of traveling. So if you are traveling out of the country, I did my surgery outside the UK, and I needed to apply for visa to another country. I needed to book my flight tickets. I needed to take leave from work and all that. So you need to also consider all of that as well. So consider what country is safer for you to go to. What is the visa application process for the country you're going to? What's the flight ticket and the flight fee like, and every other thing that it will cost you to go and to come back safely. So you need to put that into consideration as well. And what is the cost range for weight loss surgery? I know a lot of people would like to hear this. So the cost range for weight loss surgery depends on what country you're having your surgery. For the UK, it ranges from between £3,000 to £15,000. So the £3,000, well, when I was doing my research, I didn't find anyone that it was within £3,000. The gastric band, the adjustable gastric band or the gastric balloon in the UK costs £6,000. It costs £6,000, and gastric sleeve in the UK costs $10,999. As at when I was doing my research, I don't know what the cost is as of today, but as of December, it was £10,999 for the gastric sleeve. For the gastric bypass, it was £12,000. So, and the recovery period for these surgeries are also different. For the gastric sleeve, the recovery period is between 3 to 7 days. So you might need to take off work for about 3 to 7 days. Gastric bypass, the recovery period is between 7 and 10 days. So it takes a bit longer to recover from the gastric bypass because it's a more intense procedure. So for the cost is between that range, between 3,000 and 15,000 pounds in the UK. So if you are going private, of course, it's more expensive. When I was doing my research, the waiting list for the NHS was 18 months. However, the private hospitals are willing to take you within 4 months, within 4 weeks. So, but then the cost is different. It's higher in the private hospital. So for the private hospital, the gastric sleeve was about 11,000, and the gastric bypass was about 13,000 thereabouts. So yeah, so that's the cost range. For other countries, for the US, well, we'll be talking in dollars. For the US, the price ranges from $7,000 to $18,000, depending on where you're doing it, if it's private or public. But I can't really speak for the US because I didn't really dive deep into what the US surgery process is. And for the other countries, it's just within that range. Really, just do your findings and just be safe with your findings as well, because some of these countries are very dangerous to go to. All countries are dangerous to go to, really, but then just do your findings and be safe while you do that. So for Turkey, the price range is between £1,700 and £4,000. Well, that is what is accessible on, if you do your research, most of the hospitals you will find. You will not find anyone that is less than 2,500. That's the truth. So for the gastric, the adjustable band in Turkey, you will find between 1,700 and 2,000. For the gastric sleeve, you find between 2,500 and 3,000. And then the gastric bypass, you find between 3,500 and 4,000 pounds. So that's the cost range I know. What are the risks involved in weight loss surgery? So, of course, for every procedure, there are risks involved. There are likelihood of complications and things going south. 100 people go for weight loss. So they do a leak test for weight loss surgery to see if your stomach is leaking. So the leak, just put your food in front of you and eat and drink water and get up and go. When you have weight loss surgery, you can't do that. No, we don't do that here. So you eat very slowly first off, and you can't drink water immediately, because where are you putting everything? You have this size of stomach, so you need. Hope you've enjoyed this video to this point. Please consider to like, share, comment under this video if you've gained value from it. And if you're considering having weight loss surgery, please stick around to this channel. You're definitely going to get value from here. You're going to get lots of information from here. And I hope this channel helps you to make your decision on whether or not to have your weight loss surgery. So I'll see you some other time, guys. Thank you for watching. Bye.